Welcome to Then and Now, a podcast by the UCLA Luskin Center for History and Policy. We study change in order to make change, linking knowledge of the past to the quest for a better future. Every other week, we examine the most pressing issues of the day through a historical lens, helping us understand what happened then and what that means for us now.
Hello, welcome to Then and Now. I'm Elizabeth O'Brien. I'm an assistant professor of history in UCLA's Luskin Department of History, and my work is on the history of reproductive healthcare in Mexico. I'm absolutely delighted to be joined today by Dr. Cassia Roth, who is a preeminent historian and expert of women's reproductive health in Brazil and beyond. Cassia Roth is an associate professor in the Department of Society, Environment, and Health Equity at the University of California, Riverside. Prior to that, she taught history and Latin American and Caribbean studies at the University of Georgia. Dr. Roth was also a Marie Sklodowska-Curie postdoctoral fellow in the School of History, Classics, and Archaeology at the University of Edinburgh, as well as a Fulbright postdoctoral scholar at the Fundação Oswaldo Cruz in Rio de Janeiro, Brazil. She received her PhD in Latin American history with a concentration in gender studies from the University of California, Los Angeles, from the Department of History in 2016. So welcome home, Cassia. She also completed a master's in public health, or an MPH in epidemiology, with a certificate in global health at the College of Public Health at the University of Georgia. Cassia's book, titled A Miscarriage of Justice, Women's Reproductive Lives and the Law in Early 20th Century Brazil, was published by Stanford University Press in 2020. The book examines reproductive health in relation to legal and medical policy in Brazil's then capital city. It won the 2021 Murdo J. MacLeod Book Prize from the Latin American and Caribbean section of their Southern Historical Association, and has been reviewed to great acclaim in many preeminent historical journals. Dr. Roth's research has been supported by the National Endowment for the Humanities, the Fulbright Foundation, the National Science Foundation, the Citizens and Scholars Foundation, formerly the Woodrow Wilson Foundation, and the American Historical Association, as well as the Coordinating Council for Women in History, UCLA, UGA, and the European Union. Currently, Dr. Roth is working on a project entitled Birthing Abolition, Enslaved Women's Reproduction and the Gradual End of Slavery in 19th Century Brazil. Welcome, Dr. Roth. Thank you so much for joining us today.
Thank you so much, Dr. O'Brien. I'm just going to call you Elizabeth because, as well as my colleague, you are a friend of mine. So I want to thank you for inviting me here today, to thank the Luskin Center, and then to thank Rose Campbell, who is helping us behind the scenes.
It's always a pleasure to speak with you. I'm so looking forward to our conversation today, which is about reproductive health care with a special focus on abortion and pregnancy termination. And we're going to be talking today about your historical work on reproductive health care and what it can tell us about policy today, or why we should be thinking about this historical work and its policy implications, especially, in these really fraught and pitched debates in the lead up to the presidential election, right? So in recent years, Latin American countries have made some monumental decisions regarding reproductive rights and reproductive justice. Do you mind sharing your thoughts on some of the biggest developments, for example, in Colombia, Mexico, and Argentina regarding reproductive health care? How would you characterize these legal decisions and these changes in the law? What did they result from?
Yeah, that is an excellent question. And I think it's something we should all be thinking about in the lead up to the 2024 US presidential election, where abortion rights and reproductive health care in general is a pressing issue for many voters. Recently in Latin America, I'd say in the last 20 years, there's been a movement toward decriminalization of abortion and even full legalization. And when we say decriminalization, we often mean that certain aspects of abortion become legal, but abortion in and of itself is not fully legal in all circumstances, where legalization would be something like Roe v. Wade, where up to a certain gestational age, abortion is legal for any reason. So I think those two terms, decriminalization versus legalization, are interesting to think about. It's not something we hear a lot in the US. But in Latin America, in the past 20 years, more or less, there has been a movement for both decriminalization and legalization, and that has been very successful. So you mentioned some countries, Colombia, Mexico, Argentina, we could put Uruguay in there. And those successes for legalizing abortion, I would sort of put them or put those successes around legalizing abortion. I see four main reasons behind them. So, one is that movements, mainly feminist movements toward legalization, have employed a reproductive justice framework from their beginnings. And so, when we say reproductive justice in the US, we think of in 1994, a group of Black feminists gathered together to really rethink what they saw as an abortion rights movement in the US based on white middle class women's experiences. Focused on reproductive rights. So reproductive justice is this idea of the right to have children. And so that to have children spoke to the long history of sterilization, forced sterilization in the US that was often focused toward women of color. The second aspect is the right to not have children. So that is where abortion, birth control, and the choice to be a parent or not comes in. And then the third aspect is the right to raise those children in safe circumstances with equity toward economic, social, environmental justice, right? So that is also something that was missing. Those first and third parts were missing from the mainstream reproductive rights movement in the US. So the first aspect of my answer is that feminists in Latin America in these countries have always advocated for this larger, broader framework. Even before the term reproductive justice was coined in the mid 90s, activists in the US, but also in Latin America, had been advocating for that. So that's the first step. The second aspect is, I would say, characterizes them from my historical research, is this idea of coalition building over the long term. And so feminists were not just only organizing around abortion rights, but they were also making broad based movements with women or other people advocating for food justice, environmental justice, social justice, economic justice. So it was broad based, and it had a long game, right? It wasn't like we need to decriminalize or legalize abortion and then we're done. And I can get into this later about sort of the historical reasoning behind this. But one example also is Uruguay. Feminists mobilized with public health experts who were really questioning the state's criminalization of abortion in relation to maternal mortality and morbidity. And so that was a broad-based movement between feminists and public health advocates. And the public health advocates weren't necessarily speaking about abortion in the term of rights or gender equality, but feminists understood that they needed to have a coalition. The third aspect, I would say, is that there's been a reliance on legal and political strategies that make the most sense in specific contexts, and I can get into that in a little bit. So that would be, I just said about Uruguay, there was this public health discussion about maternal mortality and morbidity. Okay, well, it makes sense then to have coalitions with public health advocates and to really focus on that as being a way to legalize abortion. In Colombia, which in 2022 legalized abortion up to 24 weeks of pregnancy, making it one of the most liberal laws in the world today. Feminists were actually engaging in strategic constitutional litigation to get a Supreme Court decision that could legalize abortion. And that is something the right has done in the United States, if you think about it. They have strategically litigated in the federal courts, and eventually that ended with Dobbs, right? So feminists in Colombia, on the other side, were actually understood that playbook, right? In Argentina, it was a Senate bill. So they went the legislative route. And that's because the feminists and this broad coalition of activists understood they had the best opportunity in the legislative branch rather than the Supreme Court. And then I'll just say the last is Mexico is a federalized country, much like the United States, where the individual states have a lot of legal power. And so feminists both worked on state levels to decriminalize or legalize abortion, but also on federal constitutional levels through a specific constitutional mechanism in Mexico called the amparo. And that doesn't exist in the United States. And I don't want to totally get into the legalese behind it, but they understood they had to work both state level and federal level because of the way their legal system was set up. So that's a very long answer to this idea of relying on legal political strategies that make sense in your specific context. And then the last thing is the message, which is sort of tied to the employment of a reproductive justice framework. But where legalization has occurred in Latin America, feminists have reframed abortion rights within a public health framework that, one, makes it clear that the longstanding double standard on abortion access in the region, where wealthy women access safe, if clandestine procedures, while poor women, girls, and non-binary people die from unsafe, illegal abortions, is a matter of public health. And two, that this disparate access to abortion, which results in higher rates of maternal mortality among disadvantaged people, is a form of violence against women and thus a violation of their human rights. That has been the key message, I think. And you'll notice I sort of switch back and forth between using women and non-binary or pregnant people, and that's because this is how some activists their language has changed over time, and the circumstances have changed. So we can discuss language a little bit if you want, but I'm trying to sort of stay true to what I've read in my historical documents.
Thank you so much, Cassia. That was incredibly helpful. A broad panorama, of these strategies, historical and present day. I should have said in my introduction that you are a longstanding mentor of mine, and I always learn so much from you. And I just really appreciate you sharing this information with us. So, your work as a historian is so interesting because you work on, early time periods, as early as the beginning of the 19th century, the end of the 18th century, but you're also, very concerned about the policy implications of women's reproductive health care. And so you go back and forth between the MPH, or you combine both of these, for greater understanding of the issue, right? And you've been doing some oral histories, right, with activists who have been sharing, their vision and their strategies and their struggles and their success. Is there anything that, you'd like to share about what they feel is happening with the movement right now, next steps, surprises, big wins? What do you think that activists in Latin America, both past and present, would want to share about their vision for reproductive justice?
Yeah, that is a fantastic question. And thank you. So with Meg Weeks, who's a professor at the University of Florida, we've interviewed some feminists in Brazil, specifically, who were active in the 1980s and tried to legalize abortion when Brazil was returning to democracy after a 20+ year military dictatorship. And Elizabeth and I have talked about in the future trying to begin to have a oral history archive of activists surrounding reproductive justice in Latin America so we can get their voices out to a broader audience. And so that's something I look forward to working with you on. So I'll just speak to the feminist activists in Brazil that Dr. Weeks and I had spoken to. And they were really in the 1970s and 1980s part of this broader Western idea of second wave feminism, right? But they were also organizing for the legalization of abortion during a broader political process in which Brazil was returning to democracy. And so their organization around abortion was not like what was going on with second wave feminists in the United States. And unfortunately, they were unsuccessful in decriminalizing or legalizing abortion during this 1980s transition. And we being Dr. Weeks and I have thought about this for three reasons. So these women were absolutely steeped in second wave rhetoric of individual rights and sexuality and separating sexuality from reproduction. But they were also part of a deep conversation of human rights and reproductive justice because of the military dictatorship. But their organization was less reflective of this inclusive rhetoric, right? So these are mainly white, middle or upper middle class women. Brazil is a hierarchical society with deep inequalities based on class and race. It was the last country in the Western Hemisphere to abolish slavery in 1888. And those legacies and scars still very much define society, right? And they did in the 70s and 80s. And so it's not just that you need to have a reproductive justice framework or vision, but you need to have a reproductive justice organization. So that vision needs to be represented in the people who are in the organization and fighting. And I think that often means thinking today that, I'm a white woman, right? That we have to decenter our own needs and desires and think about a broader coalition where the people who are most affected by abortion bans have the loudest voice and that they get the support they need. So I think that's something we realize is that the rhetoric was there and the vision was there, but the organization did not reflect that. But second, these feminists did not have the support of leftist political parties. And so that is something that is different than in the US today, where the Democratic Party is full on behind abortion rights. And they have even changed the rhetoric from being pro choice to being for reproductive freedom, which is a much more expansive and broad view of abortion, right? So in the 1980s, the leftist party, particularly the Workers' Party, the PT, which is again in power today in Brazil in the presidency, had strong ties with a progressive Catholic church. And this progressive Catholic church, abortion was a non-starter. They would not support it. And so the leftist parties actually sort of sidelined feminists who were rightfully asking for the legalization of abortion to be included in the new constitution that was written after the end of the dictatorship. And this was called the People's Constitution because it was a constituent assembly where different political actors and also just everyday Brazilians were asked to participate in this constitution. This is a constitution that enshrined healthcare as a human right and allowed Brazil to implement universal healthcare afterwards. So this was a very inclusive constitution, and feminists wanted abortion to be part of that, right? But they didn't have the support of the political parties. So political party support really does matter. And the third thing we sort of learned from these interviews is that the feminists, they did not fully understand or they underestimated their adversaries. So one example of this is that when they were involved in writing this new constitution in the mid 1980s, they put forth an abortion amendment, right? A legalization of abortion. But the right wing actors who were also part of this constituent assembly put forth a constitutional conception clause where life would begin at the moment of conception, and that would be in the Constitution, which is incredibly dangerous. And so feminists withdrew their abortion amendment, and then the right wingers withdrew the conception clause. So it was sort of a draw, right? But that knowing that that could be a strategy going in might have allowed some different negotiations, but maybe not. We don't know. So that's sort of what we've learned from these interviews so far. These feminists across Latin America deserve to have their voices heard in the United States. I mean, they deserve to have their voices heard globally, but they have so many important lessons for us to learn. And so I hope that we as scholars can sort of facilitate that going forward.
This has been so fascinating to hear the trajectory and different legal strategies of various nations. You brought in Uruguay, Argentina, Are all Latin American countries moving towards the decriminalization or legalization of abortion, or are some going in the other direction?
Yeah, that's a really important question you've raised because the simple answer is no. That Latin America is a region with some of the most liberal, inclusive abortion laws and with some of the most restrictive abortion laws in the world within the same region. And so that's just an interesting thing to unpack, right? So we've had these recent expansions in Mexico, Argentina, and Colombia, and we've had also recent decriminalizations in Chile, Ecuador, and Brazil. So that's smaller steps where abortion for rape or incest has been legalized, or abortion to save the life of the pregnant person has been legalized, but not abortion for any reason. But on the other hand, these movements forward coexist with severe restrictions on abortion in various nations, and these include Haiti, the Dominican Republic, Honduras, El Salvador, Nicaragua, Jamaica, Suriname, just to name. I think those are the most restrictive. So most severe restrictions are based on two factors. So one, there's a complete ban on abortion under any circumstance within national criminal codes. So you could call this a national abortion ban, which is something that the Republican Party says they won't do, but many of them actually say they will do. They call it a national minimum standard, but that just means a national abortion ban. So many of these countries have national abortion bans, and the first thing that they do is they criminalize abortion on a national level. So there's a national abortion ban. The second thing many of these countries have done is they have enshrined fetal rights as starting since the moment of conception in their constitutions. Not all of them, but many. When you have both of these things on the books, it is very difficult to decriminalize abortion or legalize abortion. So in Central America, El Salvador, Nicaragua, and Honduras have total abortion bans, and some of them also have conception clauses in their constitution. And these are countries where women are imprisoned for 30 to 35 years for miscarriages and stillbirth. And so it is incredibly dangerous and harmful to people and their families to have these sort of laws on the books. These are also countries that are led by populist leaders on both the left and the right. Sometimes they swing between the left and the right as well. And they have a strong ties with the Catholic Church and growing evangelical movements. So it's not just the Catholic Church, but it's also growing evangelical movements in Latin America and in Central America. And many of these countries had complete decimation by civil wars in the 1980s that were funded and supported by the US, right? So they had a breakdown of their social and economic fabric. And I don't think it's a coincidence that part of this rebuilding has been a full restriction on pregnant people's bodies and rights. And so we need to think about the US's involvement, not just through the internationalization of anti-abortion movements or rhetoric between the Trump administration and the Bolsonaro administration in Brazil, but long-standing destabilization of democracy that allows for abortion rights to be restricted. So, in the DR in 2021, there was recently attempts to vote to allow abortion in the case of threat to the pregnant person's life, when the fetus could not survive outside the uterus, and when the pregnancy was the result of rape or incest. And those were all voted against. So the country continues with a complete ban, and it looks like that complete ban is now under debate for their new criminal code, and it will probably be included. So we have this forward movement and then a backward movement at the same time. And partly we look at Latin America as a region, right? Sort of we being the US public look at Latin America as this homogenous region, but it is not. It has a variety of religiosities, of political views, of types of governments, of constitutional rights. And so partly I think that's on the US public to decenter the sort of colonial imperial view of the region into something more complex, which is the region is very complex, as most regions are.
That was incredibly helpful. Thank you so much for those answers, Dr. Roth. I can't help but think about how this relates or compares to the situation in the United States. After Dobbs and the fall of Roe, we have this patchwork, circumstance in which abortion and reproductive health care is gaining protections in some states due to the demand of the voters, but obviously, experiencing really horrific outcomes due to these near bans or total bans that some conservatives are saying, even by their opinion, have gone way too far. At the same time, as you've said, that there is this real movement with Project 2025 to have a national, like you said, minimum standard. That's a new term for me. I'm learning so much from you. So, what is your assessment of the situation in the United States from your perspective, from your expertise? What would you like to comment on? The unprecedented criminalization in some states and, movements for decriminalization and legalization in other states. In particular, does your work as a historian offer insights or lessons that you'd like to share?
So I looked up what US public opinion on abortion was before this podcast. And most people in the US think abortion should be legal in all or most cases. And that was 63% by the Pew Research Center. So clearly, our state laws do not reflect popular opinion. But that kind of makes sense since our government also doesn't necessarily reflect popular opinion due to the Electoral College and the Senate. But I digress a bit. But we can see this in red states that have ballot initiatives to enshrine abortion rights. I'm thinking of Kansas and Ohio, right? There's Amendment 4 or Question 4. I don't know the exact title in Florida right now. So quote unquote, red states are having some of the most radical ballot initiatives to allow for abortion in their state. And that is something that a national minimum standard, i.e., abortion ban, could overturn. So, on the one hand, the laws we see in these red states of almost complete abortion bans, or you know what? I'm not going to say almost complete abortion bans. I'm just going to say abortion bans, because when you are not clear about when a medical provider can provide an abortion, then it's a ban. We just saw this with the death of 2 Black women in Georgia, and it's no coincidence they were Black, right? They are already facing multiple oppressions. And so we knew this was going to happen. But doctors were unclear whether they could provide the life-saving care that these women needed after taking abortion medication, which is completely safe. It's just sometimes you don't expel all of the fetal tissue. And so that was because the 6-week ban in Georgia doesn't make it clear when the person's life is in danger. So when you can intervene. So that's just a ban to me. But I would say that where the Christian white nationalist right has had its strongest wins in state houses, that's the states that have moved toward full criminalization. And if you look at a map, right, it's the Deep South, parts of the Midwest. But one of my favorite professors when I was doing my master's in public health, Dr. Andrea Swartzendruber at the University of Georgia, she does work on crisis pregnancy centers. She did this, she showed us this lecture once about maps, right? And so a map of the highest concentration of enslaved individuals. And you can follow these maps over time. And that's where the maps where there was the most Jim Crow laws or the most anti-trans laws and the most complete ban on abortion laws, right? It's no coincidence that these states that are highly unequal and have oppressive governments are the ones that are passing these laws. So So, but again, I don't think that is reflective of necessarily public opinion in all of these places. People have complex and sometimes contradictory views toward abortion. People have personal religiosity and also religious understandings, and that is okay. And it's okay to have those discussions. But we can just see overall that the United States does not want abortion bans. People in the United States do not want abortion bans. So to sort of come to the end of the question, which was like, how does the work of a historian or someone who looks at documents in the past, how does this reflect my understanding of the present? Well, one is just looking at maps over time, right? I think it's interesting to see those connections. I'm not saying there's a direct connection between like a through line that you could trace specific people over time from slave owners to, well, actually, you probably could, of people who are descended from slave owners and white Christian nationalists today. But I think it's interesting to see the historical context and understand the historical context behind who is in power, who is in political power today. But I would also say that one thing looking at history has told me is that there's always going to be movement back and forth. So there's something that a historian in Brazil, Isabel Hintz, has called waves of criminalization and decriminalization, right? And so we can't despair at this current moment because we are in a wave of criminalization and people are dying and it is incredibly dangerous, but then we can't give up if we want to move toward decriminalization. And then when we're at a point of legalization or decriminalization, we can't just sit down and say we're done because we know that there's going to be a pushback, right? So I would say that sort of understanding of this up and down in history has allowed me to view the moment as incredibly difficult, but not the end. If that makes sense.
That makes so much sense. Such a compelling connection of past, present, and visions of the future. And, this message of waves of criminalization and the use of oppression to, enact embodied forms of repression over people's personal, intimate lives is hundreds and hundreds of years deep, and we can't give up, right, on the future. So thank you so much for that. Is there, to wrap up our conversation, which, has already, taken so many of your insights and so much of your time and energy, and we really appreciate it. I wondered if you wanted to share more about your historical work and why history is important for understanding today's reproductive healthcare landscape, even thinking about your new book project on the gradual abolition of slavery in 19th century Brazil. Are there any particular lessons or insights that you want to draw on to connect to reproductive health care and the kinds of policy debates that we're having today? Should policymakers know about 19th century history and abolition when they think about their decisions today and the world that we live in and the coconut not falling so far from the tree, if I may say? So anything else you'd like to share with us about your work and how you see that it fits into these conversations?
Well, absolutely, policymakers, judges, politicians need to understand historical context. I mean, we saw this with Dobbs because Justice Alito decided to cherry pick a history that doesn't exist in the United States. Leslie Regan has clearly and definitively and empirically shown that up until fetal movements for most of American history, and I say American being US, right, history here, the public, religious officials did not view an abortion as a crime necessarily, right? But part of larger health actions or that were socially condoned. And Justice Alito in the Dobbs decision decided to overlook that and say that never existed. There was never this period where Americans viewed abortion as okay. And the AHA, after Dobbs was overturned, the AHA put together a panel that I think is on YouTube still about this. And it's very interesting because the scholars really talk about, they pick apart Alito's decision for the bad historian that he is.
And the American Historical Association, right?
Yes, AHA, the American Historical Association. So if you Google that and Roe on YouTube, it's a really fascinating discussion. So clearly we need to have empirically based sound history to inform our current policy. I think Dobbs is just one example of that. And that's the long history, right? When I think about this work, I'm looking at enslaved women and reproductive practices, creating families, trying to create families within the horrific conditions that was chattel slavery in Brazil. The same in the United States. Slavery was a period of forced birth because an enslaved child followed the legal condition of the mother. So children were new, quote unquote, property for slave owners, right? So when we want to think about periods of reproductive control in the US, slavery is an incredibly important chapter to understand that how racial inequalities in healthcare and abortion access stem from the racial inequalities forged under chattel slavery, right? So that's really important to know that. More recently, and I mentioned this briefly earlier, is that the feminists in Latin America organizing around abortion and reproductive justice and health were organizing during military dictatorships, again, funded and supported by the United States, where the government disappeared, and that could mean torture or death, but you never knew what happened to your family members. People who they viewed as political rivals. And what does bodily autonomy mean if a government can do this to you? And we know that certain populations in the United States have faced this sort of state-induced terror, right? So again, understanding how histories of that, whether in the United States or other countries, can inform our present day is very important. And I think that I'm going to just end here with a quote from Natalie Fixmore Orais and Lina Maria Morillo, who are at the University of Iowa. And they call on US feminists that we really need to name abortion care denial as violence. And that's what it is, right? And that they say that because they're looking at this history of state controlled violence against people in Latin America. And this is a form of violence. People are dying right now because of Dobbs. And, people were dying before Dobbs because Roe was based on the idea of privacy and not access, right? It was that you can make a decision with your doctor about what is best for you and your pregnancy, at least until viability. And that has nothing to do with access or equity. And so we know that after Cassi, which was a Supreme Court decision in the early 90s that said, as long as there was no undue burden on people seeking abortion care, then states could enact restrictions like waiting periods or forced ultrasounds. And this idea of an undue burden is pretty slippery. So who decides what's an undue burden? And that really eroded a lot of access to abortion. And so people were being criminalized for miscarriages and stillbirths in the United States before Dobbs. They were dying from unsafe abortions before Dobbs, but it has gotten worse. And so understanding the history behind that is incredibly important to building an inclusive policy going forward.
These are such incredibly relevant insights from history, from historians, for policymaking, for the present. I love this analysis of equity, access, and the fact that forcing people to give birth is an act of violence against them, and it leads to public health emergencies and unnecessary death and suffering. And so that's what we learn from history. That's then and now. And we are just so incredibly grateful to you, Dr. Roth. The amount of expertise and data that you have brought on this episode has been truly awe-inspiring. And I'm just really grateful to you for your work to do that.
Well, thank you so much, Dr. O'Brien. And again, thank you to the podcast and everyone at UCLA.
Thank you for listening to Then and Now, a podcast by the UCLA Luskin Center for History and Policy. You can learn more about our work or share your thoughts with us at our website, luskincenter.history.ucla.edu. Our show is produced by David Myers and Rosalind Campbell, with original music by Daniel Reichman. Special thanks to the UCLA History Department for its support, and thanks to you for listening.